A new round of government cuts could affect Americans' health care. Yesterday, the Department of Health and Human Services announced its workforce is being slashed by around 20,000 people. That is almost 1 in 4 workers there. It's part of a planned, much discussed overhaul by HHS Secretary Robert F. Kennedy Jr., and it could affect everything from disease prevention to food safety. Dr. Celine Gounder is a CBS News medical contributor and editor-at-large for public health at KFF Health News, and she joins us now. Dr. Gounder, wow. So the mission of HHS is to enhance the health and well-being of Americans. How does this help that mission?
There are a number of different agencies that fall under HHS. So some of the hardest hit include the Food and Drug Administration, which vets and approves drugs and other medical devices and so on. You have the Centers for Disease Control and Prevention, another very hard hit agency that helps Americans stay healthier by helping to prevent outbreaks, addressing chronic diseases, preventing injury, et cetera. Then you have CMS, which is the Center for Medicaid and Medicare Services, Medicare and Medicaid Services, which are two very large publicly funded insurance programs for the elderly and for low-income people. And then you have the NIH, which does biomedical research, which is how we end up with new drugs and other advancements in medicine.
So we see that it covers a lot of agencies, but the big question now is how do you think it'll affect Americans' health, the impact it'll have?
Well, that remains to be seen. But when we're talking about agencies that touch so many parts of Americans' lives, will we see more foodborne disease outbreaks? Will we see delays in drug approvals or measures to improve our food supply, which is, by the way, one of the agenda items for the new HHS secretary? Will we see a slowing in biomedical research? We've already seen China and European countries trying to recruit our scientists because scientists here are concerned about their job opportunities. We've seen some leave for Toronto. I just heard of a few from Yale who just left for Toronto. You have students who are worried about going into research because they don't know that there will be jobs. So I think this is very concerning, both in terms of the immediate impacts on health care, public health, and the longer-term impacts on whether we will maintain our leadership in the health space.
And at a time of measles and bird flu,
That's
Dr.
what,
Gounder.
I was just thinking that too. It seems
Thank
like
you.
it's needed now more than ever.
More than ever.
Thank you, Dr. Gounder.
Yeah, thank you.